Hi guys, I got a really sad email into my inbox this week. Somebody said, I've got shaky hands and I can barely hold a cup nowadays. I'm 60 and it weighs, in my 60s, and it weighs heavily on my mind. Should I be worried? So I was really sorry to hear this because as we get older, people do get tremors and we kind of dismiss it and don't understand how debilitating it can be. I sat next to somebody a little older than 60 on a flight recently who was really suffering badly with a tremor. And it made absolutely everything they did, from holding a drink to opening the sugar, to taking the lid off an orange juice, to opening the seat table, really difficult. It's dangerous if they were holding a hot drink and spilt it on themselves. So it brought home to me how dangerous and debilitating a tremor can be. Tremors definitely arise with increase in age, and they tend to fall into one of two categories. So you've either got an action tremor, shaking as you're trying to perform a movement or an action or a task. So reaching out for a spoon, holding a cup. These tremors usually are caused by muscle contractions, and they're not usually a sign of anything worrying, of any underlying neurological disorder. So that's the good news. Resting tremors are the are the other type. So this is a constant tremor, whether you're doing an action movement or completing a task, or your arm and hand is completely stationary. Resting tremors can be a sign of an underlying neurological disorder. For example, Parkinson's disease has a really classic tremor that we look for when we're diagnosing it. Most tremors, however, will be benign, so that's the good news, although some may be a developing health condition. So it's always important to get it checked out, get reassured, because if it is the worst case scenario, sooner is always better when it comes to treating these things. So in the meantime, assuming you have a benign tremor, this can be a response to triggers. So triggers that are commonly involved in causing a tremor are anxiety, fatigue, chronic stress, low blood sugar, too much coffee, caffeine, excess alcohol, or even nicotine. So if any of these could be making things worse for you, have a look now. If you're doing lots of those things, you know you might have found an answer. There are medications that can also make a tremor worse or even cause one. Anti-seizure or epilepsy medication, stimulants like the things people take for ADHD, mood stabilizers, immunosuppressants, hypertension meds, antivirals, antibiotics. And then vitamin deficiencies like vitamin B12 can actually affect our nerve health and can be the cause of a tremor. So let's look at treatments. So assuming that you've seen your GP and there's no underlying health condition causing your tremor, then there are definitely things that you can do. So first of all, identify the triggers. Know which ones worsen your particular tremor, because what causes your tremor may not cause mine. But then once you've identified them, limit them if you can. So if it's caffeine, cut down. If it's alcohol, cut down, and so on. Medications. Discuss side effects of medications with your GP and any interactions that might be going on between your medications. Look at your activities of daily living and ask your doctor for an occupational health assessment of how well you're coping with specific activities that might have aids to help you carry them out. Make lifestyle changes. So avoid that caffeine, avoid alcohol, take up relaxing things like yoga or even Tai Chi to stabilize the core and the use of your limbs. And then medication. If none of the above works or things are getting worse, there are other treatments that can help treat tremors, like medication, Botox injections, high frequency ablation, or deep brain stimulation. So, long answer short to my original question, you've probably got no need to be worried, but you do need to have an assessment just in case your tremors are caused by a developing health condition that can then be treated. I know it's nerve-wracking, but it's always good to know, because when you know, you can do something about it. So I hope that all helps, and good luck.